AIA Vitality. Your health is every choice you make. We are part of a global wellness program with over 1.65 million members in AIA across Asia. And in Singapore, we have more than 100,000 members on AIA Vitality. Members live healthier by knowing their health through online health assessments and screenings. They improve their health by logging exercises and enjoying the rewards to keep them going. And indeed, members are making improvements in their health. Even the vitality age gap has narrowed to less than a year. Best of all, you earn points for every activity. The higher your status, the greater the rewards, including up to 15% off insurance premium on selected AIA plans. To keep you going, there is the weekly fitness challenge, with personalized targets to help pace and improve your fitness. When you complete the challenge, you get a spin on the Vitality Wheel to earn Vitality Coins, which you can use at the marketplace. That's not all. You also earn AIA Vitality Points for completing these activities. And very soon, you'll be on your way to Platinum status. And we sweeten the deal further with many exciting partner benefits that you can enjoy. With AIA Vitality, nothing gets better than a healthier you. So get onto AIA Vitality today, because your health is every choice you make.
Ladies and gentlemen, welcome back to AIA Health and Wellness Live 2020, powered by AIA Vitality. We're almost at the end of the program, but we're not ending just yet. Next, we will be speaking on a very important subject on the topic cardiac death during exercise. Am I at risk? Now, you may have heard of the news of a couple of sudden deaths when young and fit individuals had collapsed suddenly in the middle of their workouts. We wonder then, what causes cardiac arrests, and are we all at risk of them as well? And this is precisely why we have with us today Clinical Associate Professor Ching Chi Kyong. He is a senior consultant with the Department of Cardiology, Director of Cardiac Electrophysiology and Pacing, and Director of Quality Management at the National Heart Center, Singapore. He is a heart rhythm cardiologist and treats patients with heart rhythm disorders. Before I hand my time over to Professor Ching, a couple of the usual housekeeping announcements. To start off the session, we have launched a poll question which can be found in the chat box located below this live webinar stream on this page. We would appreciate if you could take a quick moment to take part in it. We will be launching a few other poll questions intermittently during Professor Ching's presentation as well. We also have time to take a couple of questions at the end of this presentation. So if you do have any questions you would like to ask, we welcome them in the Q&A section below as well. Without further ado, I will now hand my time over to Professor Ching, please.
Thank you, Anarin. It's a pleasure to be here. And we are touching base on a very important topic, sudden cardiac death, especially during exercises, and whether if one of us or we are at risk. Before I start the presentation or the talk, I have a question for the audience. Likewise, I would like to pose a question to you. Do you think sudden cardiac death or sudden cardiac arrest is a heart attack, is not a heart attack? I frankly have no idea, and hence I'm dialing in for this program. What do you think?
I definitely know that I fall under category 3.
All right.
I have no idea, but if I was to make an educated guess, I would go with number 1. I would say that it is a heart attack.
So I hope the next 45 minutes will be a time well spent for you as we get acquainted with this topic of sudden cardiac death.
Absolutely, and I see that we are getting our results coming in now, so I do implore everyone watching this webinar to just go down to that poll section and see if you can answer this question. Studying cardiac death, number 1, it is a heart attack. Number 2, it's not a heart attack. Or C, I have no idea. So we're watching those come in right now, and we'll give you just a couple more seconds to give us those results. And I believe the results are coming in.
All right, 66 responses felt that sudden cardiac death is a heart attack. 16% felt that it is not a heart attack. And we have 16 respondents who are honest, who say, I have no idea. All right, let's go into this topic about sudden cardiac death. Let me show you a video. Let's talk about what is a heart attack. As they play this video, you could see that the heart muscles is supplied by blood from the arteries that nourishes it. I hope you could see the video playing on your screen.
The heart is responsible for pumping oxygen-rich blood to the rest of the body, providing the energy that the body needs to function. The muscles of the heart itself also need a supply of blood. The coronary arteries, one of which we see here, fill that need. Sometimes a cholesterol plaque forms on the side of the artery, reducing blood flow. If part of that plaque breaks through into the artery, platelets tend to attach to it, creating a blood clot, further reducing or blocking blood flow. The blockage in the artery prevents blood from reaching part of the heart muscle. Without blood, the muscle is starved for oxygen, causing damage to the heart muscle. The heart attack occurs because the damaged heart can no longer pump properly.
All right, you would have heard and seen the video. All right, the video shows that the heart muscle, or the heart as we know it, pumps about 100,000 times a day. And to supply the heart muscles of rich nutrients and oxygen, you have a set of arteries that supplies blood to the heart muscles. In some patients with high cholesterol, for example, there is a chokage of the artery. It blocks out blood flow. If it clots up, it starves part of the heart muscles from nutrients and oxygen, and as a result, that part of the muscles die. That is a heart attack. So patients may have chest pain. The pain may go to the neck. It makes them stop what they are doing. And if it's not treated in time, part of the heart muscles will die. And as a result, the heart function deteriorates. That is a heart attack. A heart attack occurs when there's death in a portion of the heart muscles. Let me show you the next video. It's a video about sudden cardiac arrest. If it's not treated in time, it leads to sudden cardiac death.
A healthy heart beats in a regular and coordinated way at a rate between 60 and 100 beats per minute to pump blood to your body and brain. However, heart disease can cause your heart to suddenly start beating very fast and quiver instead of pumping blood effectively. If left untreated, this rapid heartbeat can cause sudden cardiac arrest and may lead to death in minutes. Many different conditions can put you at risk of sudden cardiac arrest. These include if you have heart failure, if you have a heart that pumps poorly, if you have had a heart attack, if you have survived an episode of sudden cardiac arrest, or if you have a family member who has experienced sudden cardiac arrest. It's important to take appropriate action as soon as possible because sudden cardiac arrest can happen at any time. There is no way to predict when it will occur, and there are no specific symptoms or warnings.
Please refer to the YouTube links for a full video of a heart attack and sudden cardiac arrest. Sudden cardiac arrest is different. It is a disease that involves the electrical system of the heart. You know, the heart pumps about 100,000 times a day. To tell or prompt the heart to pump in a sequential, coordinated manner, to pump a little faster when they need to exercise or climb the steps, or to slow down as they rest, there is an electrical system that coordinates this activity. Now, cardiac arrest refers to a disease or an emergency condition related to the electrical system of the heart. Now, when that happens, the lower chambers of the heart goes too fast, too chaotic. In fact, it is as though the lower chambers goes into a muscle cramp. It does not pump blood effectively out of the heart to the rest of the body. And within 4 minutes, a person gets brain dead, brain damage, and even if he's rescued, he may have severe brain damage for the rest of his life. And the only way to rectify sudden cardiac arrest is to deliver a life-saving shock. So sudden cardiac death is a condition related to the electrical system of the heart. This slide summarizes what it means. It is caused by ventricular fibrillation, or VF. It's a medical term for abnormal rhythm in the lower chambers of the heart. It is rapid, it is chaotic, there's no efficient or effective pumping action of the heart. Blood doesn't go to the brain or the rest of the body. The blood pressure goes to zero or not measurable, and the patient becomes unconscious. It is a medical emergency. This is a slide that summarizes what is a heart attack versus what is sudden cardiac arrest. Heart attack is a pumping problem in the heart. There's a blockage in the blood vessels. It prevents blood flow to the heart, and that damages the heart muscles and scar tissue. Sudden cardiac arrest relates to electrical problem in the heart. The heart stops pumping abruptly and without warning. If it's not electrically shocked within minutes, death occurs. So that's the difference between heart attack and sudden cardiac arrest. In a person who sustain a heart attack or a massive heart attack, it may cause electrical instability and leads to sudden death. But the mechanism is a chaotic electrical response in the heart. These are the symptoms between a heart attack and sudden cardiac arrest. They are different. Heart attack refers to reduced blood flow to the muscles of the heart. With that, the person has chest pain, and it is pain that comes for minutes. It may spread to the shoulders, to the neck. It restricts their activity. They find that they are not able to complete the task. The pain will get worse if they try to climb the steps or continue with exertion. It may be accompanied by sweating, cold sweats. They may feel nauseated. They feel short of breath, and they have difficulty in breathing and a sense of rapid or even irregular heart rate or rhythm. It prompts them to stop what they are doing, and if it's a minor heart attack, the pain may be relieved as they rest or reduce in intensity. But in a heart attack, the pain persists despite resting. They will need to see a doctor urgently to get the adequate treatment to relieve them of this blockade in the heart. Whereas a sudden cardiac arrest is sudden, the person collapses, he loses consciousness. If you look at him, he stops breathing normally. He may be breathing heavy, prolonged breath, but it's abnormal breathing. And if you know how to palpate for his pulse in his neck or on his wrist, you found that there is no pulse and there's no measurable blood pressure. And that is a medical emergency. Now, question number 2. If you walking down the streets or shopping along Orchard Road and you witness a person turn unconscious and fall to the ground, what would be the most appropriate response? Would it be 1, take out the tiger balm that you have or X oil and apply some ointment on the person's face, hoping to revive him? Quickly check if the person is responsive. Say, hello, hello, are you there? Do you hear my voice? How are you? And if he is breathing normally, or you know what, it's time to take a video and perhaps post it online.
Well, I certainly hope no one chooses option C. I don't suppose that would be the right thing to do.
I hope so too. I mean, it's not, the first response is not uncommon when I was a kid. If you're unwell, my mom does apply some X oil on my face, tiger balm to hopefully energize me.
Yes, yes.
Are the polls ready? All right, I'm glad to say that 97% of the respondents chose option 2, which is to check if the person is responsive and breathing normally. That is absolutely the right thing to do. Go to the person, tap his shoulder or her shoulder, check on him, say, hello, hello, are you okay? Do you hear my voice? Speak to him, whether he responds to you, and if the person is breathing normally. If they are unresponsive, they do not breathe normally, it is a sudden cardiac arrest, most likely. When that happened, bystanders really need to help the patient or the victim so that he make a good recovery. Please get help, call 995. I hope you are trained in CPR. If not, please call 995. They will prompt you and teach you how to do on-site CPR. Now, because sudden cardiac arrest may be rescued with an early shock or electrical shock, what we call early defibrillation. Get an automated external defibrillator, an AED for short, that would help the patient restore normal rhythm. And by then, the ambulance should arrive and fetch the patients for early advanced care. With this, we could optimize a person's recovery and chance of good recovery. As mentioned, number 1, if you see someone fall down, stay safe. Tap and shout. You call 995 and get an AED. As mentioned, you check for breathing. If there's no normal breathing, proceed to do chest compression as in CPR. And after that, after starting chest compression, if the AED arrives, there are audio prompt that teaches you how to apply patches on the person's chest. Follow the instruction if need to. If it's what we call a shockable rhythm, press a button to deliver a life-saving electrical shock to restore normal rhythm. So that's a good response and the right thing to do if you see someone turn unconscious in the streets. This is a strip of a person with an internal cardioverter defibrillator. On the left half of the screen, it shows the heart or the person's heart going into ventricular fibrillation. You can see that there is a lot of signals and the heart is pumping rapid and in a chaotic manner. And the green arrow shows the time, the instance when the device delivers a life-saving shock. Once the shock is delivered, it restores normal rhythm. You would see on the right half of the screen that the ECG or electrocardiogram slows down, the heart pumps slowly, regularly, and effectively to deliver blood from the heart to the rest of the body. By doing that, we abort a sudden cardiac arrest event, and the patient survives well with intact brain function to move on to his life episodes and events. So this is the right answer. I'm glad 97% of the respondents chose this. So early CPR on the top strip helps victims survive, but early defibrillation improves survival. And if you are able to deliver and provide good bystander CPR, provide early defibrillation with an AED, the ambulance arrives and sends the patient for early advanced care, it really enhances good survival. So that's what we call a chain of survival. Different pieces of the jigsaw puzzle must come together to help that victim survive the episode and survive it well, to live well for the rest of his life. Now, back to the main topic, who would be at risk for sudden cardiac death? Fortunately, most individuals in the general population are not at risk for sudden cardiac death, but individuals with these conditions would be at risk. If a person has a heart that pumps poorly, it's called left ventricular ejection fraction, or LVEF. It measures the amount of blood pumped out by the left lower chamber of the heart. If it's less than 35%, that person is at risk for sudden cardiac death. A normal LVEF is more than 50% in normal individuals. If that person has heart failure refers to reduced effort tolerance. They are exceedingly out of breath on doing minor activities like climbing the overhead bridge. It causes them to stop halfway along the steps leading to the overhead bridge. They may have shortness of breath when they're lying down. It makes them feel as though they need to gasp for breath, as though they are drowning. They need to breathe real deep and hard. They have swelling of the feet. Together with all the symptoms, those are signs of heart failure. Patients with heart failure are at risk for sudden cardiac arrest. If someone has a previous heart attack, a part of the heart muscles are damaged, and that could be a nidus for abnormal electrical activity, and it may trigger sudden cardiac arrest. Of course, someone with a previous episode of sudden cardiac arrest. If a person has family members, usually first-degree relatives, a parent, a sibling, or even a child who had experienced sudden cardiac arrest, it may be a marker of inherited causes that trigger or predispose or put them at risk for sudden cardiac arrest. So not all I'm glad to say not everyone in the general population is at risk. Those with this condition should pay attention and perhaps be more cognizant of the symptoms when they exercise. This is an example or slide showing the LVEF, which is the function of the left lower chamber of the heart to the risk of sudden cardiac death. You could see that on the right screen, someone with a LVEF of 50 and above, which is seen in most normal individuals, the risk of sudden cardiac death is really low, versus those with a LVEF of less than 30 on the left screen, a 7.9% risk per year. So LVEF is very important. If anyone out there has an existing heart condition, please ask your doctor, "Doctor, what is my LVEF? Am I at risk for sudden cardiac death?" If it's below 35%, talk to your doctor. It seems that I may be at risk. What can I do to reduce the risk of sudden cardiac death? I'm glad to say that the incidence, which is the rate of sudden cardiac death, is highest in the lower part of this chart. Someone with poor EF of less than 30%, someone with a previous cardiac arrest episode, and of course, someone who had inherited conditions that put them at risk of sudden cardiac death or arrest. One more question before we move to the rest of the presentation. Sudden cardiac arrest may occur during 1. Recreational exercises, 2. Vigorous exercises, 3. At rest or sleep, or 4. All the above. Please poll and let us know what you think.
As those poll is coming in, I hope you don't mind if I take a quick guess at this. I'm going to say that sudden cardiac arrest may occur most during recreational exercises. So I suppose we'll see when the results come in. So if you're watching, just do go down to that poll section and indicate your answer below.
I must say some of the most sensational news pieces will be patients or victims who are doing recreational exercises.
Yes, we've heard a lot of that recently in
That's
the
right.
news. And it's particularly shocking because that just goes against the common conception that, hey, if you're fit and healthy, then you shouldn't be subject to this kind of thing. We're seeing the results come in.
I must say that the attendees of these webinars are very well informed. 90% voted option 4, all of the above, that sudden cardiac arrest may occur during recreational, vigorous exercises, at rest and at sleep. And you are correct that it can occur in any instance. Now back to your question. We seem to hear more responses and newspaper clippings and posts on victims who died during recreational exercises. And well, you're quite right in the sense that the absolute number may be higher because a lot more people do recreational exercises, whereas fewer would do very vigorous exercises as in competitive athletes or sports. So the absolute numbers might be a little higher in the general population. But the incidence, which means that the risk is much lower with general population doing recreational exercises. These are some data that we have for an older adult, usually 65 and above, who exercise frequently, may have an increased risk of up to 5 times of sudden cardiac arrest during vigorous activity. And this is usually due to the presence of coronary artery disease, meaning the arteries, the heart is blocked. And when they are doing aggressive and very vigorous exercises, it causes part of the heart muscles to be starved of adequate oxygen, and that sets up a trigger for sudden cardiac arrest. about 5 times if you are doing vigorous activity, and for those who are doing frequent exercises, compared to someone who do not exercise. You know, as my teenage son would tell me, he does his exercises on his thumb, on his smartphone. They have up to 56% risk, or 56-fold increased risk of sudden cardiac arrest during vigorous exercises. So it pays to stay active, it pays to exercise on a regular basis. And in most instances, recreational activities would be all right, even in patients with an existing heart condition. I tell my patients there are a lot of benefit with exercises, apart from the health, apart from strengthening the heart, strengthening the muscles. It also have a lot of mental well-being and health to exercises. So there are a lot to gain with exercising, but you need to find your sweet spot. One should not overly strain themselves beyond what they can bear. So it's all the above. I'm glad that you made the right response. How do we identify those at risk? Well, if you or your relative or your family member has a history of heart disease, if you may have a close relative with sudden cardiac death, that may put you at risk of sudden cardiac death. If on malexertion or doing recreational exercises, one gets breathlessness and chest pain that limit your exercise, you find that you need to stop after 50 meters, maybe after 100 meters. You can't go on. It may be a symptom of underlying heart disease. If you have unexplained giddy spells or blackouts, especially on exertion, it may be worthwhile seeing a doctor to have that checked out. Or if you experience prolonged palpitation, which means the heart goes fast, erratic for minutes, unexplained, maybe you need to have that checked out. Checked if there is underlying heart disease, checked for heart function, and have it assessed and have that condition treated. For those with an existing heart disease, I would recommend we avoid competitive sport or very strenuous activity. Recreational activity, going for a brisk walk, doing Tai Chi, yoga stretches, you are usually safe. Please take your medications on a regular basis. That would help reduce the risk of disease progression and reduce the risk of adverse events such as heart failure and sudden cardiac death. It pays to keep to a healthy diet and a healthy lifestyle. And in those who are at high risk of sudden cardiac death, implantable defibrillators would help. It does not prevent sudden cardiac arrest, but it will rescue someone from sudden cardiac arrest within a minute, up to 99% effective. This is my final slide. On the left, it shows an automatic external defibrillator. These days, the machine comes with voice prompts. It teaches and prompts you how to apply the patches and to shock the patient or the victim if he has sudden cardiac arrest. On the lower panel is internal cardioverter defibrillator. It is implanted below the left collarbone in patients who are at high risk of sudden cardiac death. That system will automatically detect and rescue someone from sudden cardiac arrest with 99% effectiveness. So this has been sudden cardiac death during exercises. Am I at risk? And I hope you learned something, and I'll be glad to take any questions. Thank you.
Thank you so much, Professor Ching, for such an insightful and an informative presentation. I believe that a lot of our attendees and viewers today have a lot of questions for us, and that I think we can just dive straight into that Q&A. So knowing that we are all staying at home today with the circuit breaker and with COVID-19, is it advisable to have an AED at home?
All right, the AED helps to rescue a person from sudden cardiac arrest. I've shown previously in my slide, in patients who are at risk of sudden cardiac death, they should really seek treatment and have that risk assessed. If they are deemed to be at high risk for sudden cardiac death, I think an internal cardioverter defibrillator would be the best way forward. Now, an AED is really a machine or equipment placed at a convenient spot so that anyone who stays around the vicinity may retrieve it and utilize it. I am not aware of any recommendations to have a personal AED at home. The guidelines and societies do not recommend that because the risk of sudden cardiac death in healthy and normal individuals are very low. It may not make much sense, be it economical, be it using various resources to have an AED in every home. But do know where an AED might be, because it may not just save your family member's life, it may actually save your neighbor's life too.
I see. So definitely advisable to assess the risks and then obviously to understand where the nearest AED might be in our vicinity.
That is correct.
Okay, super, super. We have an audience member, Chi Wee, who has posted a scenario for us. His elderly mum feels unwell due to insomnia and complains that her heart often feels cold. And they do not have an AED at home. Do they then have to rush down to the void deck to collect the AED? And what would it mean or indicate when his mother indicates that her heart feels cold?
So, in general, if someone loses consciousness, he turns unresponsive and does not breathe normally, that person may be experiencing a sudden cardiac arrest event. When that happens, as shown in the slides previously, you get help, you do chest compression, and you get an AED. From the question from this person talks about feeling unwell due to insomnia and feel that the heart often feels cold, which I would assume that the chest feels cold. That doesn't sound like she's unresponsive. It doesn't sound that she's breathing abnormally. Doesn't sound like she has a cardiac arrest. But it pays to perhaps bring your mom for a checkup with the family doctor, and if needed, to a cardiologist to assess whether she has any heart disease. And if she does have heart disease, whether she's at risk for sudden cardiac arrest.
Okay, excellent. So we have another question coming in. Should we then reduce our vigorous exercise as we age? And similarly, what is the definition of vigorous exercise based on the percentage of maximum heart rate?
Let me give you a formula. The maximum predicted heart rate for an individual would be 220 minus your age. You know, you look like you're just about 20 years old, so I would expect your maximum predicted heart rate to be about 200.
Okay.
So that's 100% of your heart rate that you should go up to. I recommend for recreational activities, especially in the older folks, to go at about 60 to 70% of your maximal predicted heart rate. That's enough to cause one to be a bit breathless, to increase level of exertion, to work up a sweat, and at the end of it to feel good because of the health benefits of exercises. So that would be one formula that you would use. Stick to that. That helps regulate your exercise intensity. Now, as to whether should all reduce vigorous activity, I think that's a case-by-case, individual-by-individual question. Some of my patients who are in the late 60s and early 70s gets upset with me because they are doing triathlons, they are running, they are cycling, and they are swimming, and they feel they are fitter than they have been decades before. So I think that's a very case-by-case, individual-to-individual question. By a pace, to exercise to a certain level. And I tell my patients, please find your own sweet spot. I'm sure your sweet spot is quite different from mine. You know, to make you work and run at a heart rate of 160 beats per minute would be a breeze. I would be struggling, you know, at 160 beats per minute. So individualize the approach to exercises would be the best way forward.
Okay, and just to repeat that formula, that was 220 minus your age, and that's 100% of your maximum heart rate. And then you would recommend 60 to 70% of that.
For recreation activity, that is correct.
Super, super. We have another question. What is the way for us to assess whether we are pushing ourselves or going over the limit?
All right. I remember when I was young, you know, as a teenager, we would do runs along McRitchie. How do I know if I'm pushing myself too much? You begin to get breathless exceedingly. You're gasping for breath. You can't catch your breath. You get cramps or sore feeling in your hands and your feet because that's when anaerobic respiration occurs. Too much carbon dioxide accumulates in the body. You may get lightheaded, and when you start vomiting because you are just going too much. I don't recommend anyone to do that for recreational activity. Of course, if you're a competitive athlete, that's a different ballgame altogether. If I'm referring to the normal folks out there doing their regular walks, recreational activity, don't do it till you're exceeding out of breath. You're able to breathe and able to conduct short conversation, short sentences. There's no exceeding pain or soreness in the legs or in the part of the body that you're exercising. You don't get unexplained lightheadedness or giddy spells, or you feel that you're about to faint, or you don't get heart rate that's exceedingly fast. And the formula that we talk about is a useful guide to track and to regulate or modulate heart rate during exercises.
That's really useful information for myself as well, because I like to work out during the weekends, and it's good to have that formula. So moving on to some of the questions on risk, we do have a question from Gina. She seems to have experienced some irregular heartbeats during her childhood. Does that mean that she is at a higher risk of sudden cardiac arrest?
Probably not. We really have to diagnose the irregular heart rate or beat. We need to catch that with an ECG and make a diagnosis. It's only when we have a diagnosis then we could risk stratify someone for sudden cardiac death. Well, as mentioned, the serious symptoms would be unexplained fainting. The person loses consciousness in an unpredictable, can't explain, or you're having relatives who had a sudden cardiac death event. And if anyone with a relative who had sudden cardiac death, it is death at young age they are worried about. For example, any death that occurred less than 40 years old, we are worried and concerned if that person died due to inherited causes leading to sudden cardiac death. Sudden cardiac death may occur in an older individual due to undiagnosed heart disease, and most commonly due to coronary artery disease that leads to a blockage in the arteries, and that starves the heart muscles of nutrients such as oxygen. So I think I would recommend if you if anyone has any symptoms out there, you feel the heart is racing, you feel that you have irregular heart rhythm, you may have a little chest discomfort, it is best to have that assessed with your family doctor and, if needed, with a cardiologist.
Similarly, we do have a viewer who's asked a question. Their father passed away due to a stroke and his mother due to an ischemic heart failure. Does that mean that that particular viewer would be at risk of a cardiac attack?
So we are talking about cardiac or heart attack, not a sudden cardiac arrest. So a heart attack, as mentioned, refers to reduced blood flow to the muscles of the heart, leading to a death of the muscles, and that's a heart attack. Yes, if someone in the family is at risk or had heart attack, especially if they had it when they are young, they may have undiagnosed high cholesterol in the blood, and that may put them at risk of coronary artery disease and heart attack. So I recommend that person to have your health screened, check for your cholesterol level, have that controlled if needed. That would put you at lower risk of developing serious coronary artery disease.
And in the event that there would be no family history of any cardiac arrests at all, what could be the reasons for a particular individual who might experience that?
So a cardiac arrest relates to electrical instability of the heart. Now, that can occur in a few ways. Number one, in a person with previous heart attack, there is a part of the heart that is damaged, and that's a trigger or put them at risk of electrical instability leading to sudden cardiac arrest. Secondly, some patients or individuals may have abnormal heart muscles. It might be abnormally thick in a condition called hypertrophic cardiomyopathy, where the heart muscles are thick. When it's thick, it requires more nutrients and oxygen. So there is this imbalance, and at times, there may be inadequate nutrients and oxygen in that thick portion of the heart muscles, and that puts the person at risk for sudden cardiac arrest. Thirdly, there are people with inherent weakened heart muscles. It's not due to a blocked artery. The heart muscles over time just loses its pumping activity, and that put them at risk of abnormal electrical current or activity and sudden cardiac arrest. We know that the heart is regulated by an electrical system. It pumps or it signals the heart to pump at a suitable rate for that degree of activity. In some patients, they may have disease involving this electrical system. For example, like Brugada syndrome, long QT syndrome. In the serious cases, the electrical activity is chaotic. It gets triggered to go into a chaotic and irregular manner and put the person at risk for sudden cardiac arrest. So these are some of the inherited or what we call congenital conditions that predispose someone to sudden cardiac arrest. It may also mean that, or rather, it doesn't mean that a person must have a relative. No, my parents should have that before I inherit it. There are also gene mutations. During development, for some reason, there's some shifts and changes to the genes that forms the electrical system of the heart, and that may predispose that person to sudden cardiac arrest. But I must say, the incidence, which means the number of cases in the general population, is by and large very low. Okay. The risk is really low compared to someone with a heart attack.
And upon successful recovery from a sudden cardiac arrest, what does one need for a full recovery?
If a person is rescued immediately when the cardiac arrest occurs, it restores normal heart function, blood goes to the brain, he needs little or no rehabilitative services. But if he survives or rescued late in the chain of survival, which means there's CPR, there's late defibrillation, and by the time he goes to the hospital, there is irreversible brain damage, then that person needs a lot of rehabilitative services to achieve full recovery. And in most cases, they would have some permanent brain damage, limiting their normal activities thereafter. So it is best to avoid a sudden cardiac arrest. Second, best to take measures to reduce the risk. And third, for someone who is at high risk, to have an ICD implanted.
I see. And talking about those measures to reduce as much risk as possible, how often does the average person need to get a heart test done? And can it be done at the National Heart Centre?
Most health screening will be done by our family physicians. And I think most family physicians are very well trained and equipped to do health screening. Whereas those with a known heart disease and serious heart disease are often seen at National Heart Centre so that we could help personalize treatment for that patient. Firstly, to control the disease, to reduce progression of disease. Thirdly, to perhaps assess risk of sudden cardiac death and mitigate that risk.
I see. Okay, well, thank you so much for all of your insightful sharing, Professor Ching. Unfortunately, that is all we have time for today. So I know I speak on behalf of our audience when I express my gratitude for sharing this presentation with us. Thank you, Professor Ching.
Thank you. It's a pleasure.
This was the AIA Health and Wellness Live 2020 powered by AIA Vitality. If you're interested to find out more, do head over to the Engage section of our page where we have live agents from AIA ready and on standby to have a chat with you. But don't head off just yet. Stand a chance to be one of the 5 lucky winners to walk away with a Starbucks gift card worth $20 each. We have a quiz that is just about to pop up on the screen at the end of this session. So if you paid close attention to the session and be one of the first 5 to submit all the correct answers, the prize is all yours. Coming up shortly is our last program for the AIA Health and Wellness Live 2020. Principal nutritionist and founder of Health Can Be Fun, Fiona Chia, will be taking us on a virtual tour of cold storage before demonstrating a couple of healthy and tasty recipes. It's almost lunchtime, so her session will be starting in a couple of minutes at 12:30 p.m. Bye-bye.